Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then, now, in the vernal keratoconjunctivitis, what is important are the signs. The signs of vernal keratoconjunctivitis can be divided into two types. One, we have palpebral signs and the limbar signs. Palpebral signs. What does this mean? Palpebral is actually in the eye eyelid. The signs which are present in this eyelid are palpebral signs. In the palpebrae, there is papillae are seen. In the palpebral conjunctiva, we see presence of papillary hypertrophy is seen, especially in the superior tarsus. So these are the conjunctival papillae with papillary hypertrophy, which is seen in vernal keratoconjunctivitis. The papillae will become large. These papillae will become large, giving the appearance of cobblestone appearance is seen. So on the eyelid, the features which are seen are called as palpebral vernal keratoconjunctivitis. Then second, we have limbal vernal keratoconjunctivitis. Right. In limbal vernal keratoconjunctivitis, here the changes are seen in the limbus. Limbus is actually the junction of the cornea and the sclera. This part is the limbus. So around the limbus, papillae are seen around the limbus also. So limbal papillae are also seen, which have smooth and round texture is seen in the limbal papillae, and the patient. So these are the limbal papillae which are seen. Okay, and these limbal papillae are seen, and along with that there is also development of horner tranter spots are seen, which are actually composed of eosinophils. These are limbal papillae which are nothing but horner tranter spots are seen. Along with that, the patient will have some complications also. So in the complications, sometimes complications or even other features, here the patient can have an ulcer. The patient can develop shield ulcer can be seen in the patient. Along with that, the patient can develop pseudogerontoxin or cupid bow architecture can also be developed in the patient. A pseudogerontoxin or cupid bow is also seen in the patient, has complication. Then treatment of vernal keratoconjunctivitis. Vernal keratoconjunctivitis is treated by giving the patient with topical steroids. You can also give topical mast cell inhibitors, especially sodium chromoglycolate is done. There are also other drugs which are also topical mast cell inhibitors, like we have epinastin or allopatidine are also the topical mast cell stabilizers. Antihistaminics can also be these epinastin and allopatidine are topical mast cell stabilizers, and they are also they are mast cell stabilizers, and they are also antihistaminic drugs, so they have a dual action.
thank you and thank you for watching.